How to take care of an Alzheimer patient at home. Caring for a loved one with Alzheimer's disease can be challenging. But there are several tips and strategies that can help make the caregiving experience more manageable. Here are some tips for handling an Alzheimer patient at home. 1. Establish a routine. Patients with Alzheimer's disease may feel more secure and comfortable with a consistent routine. Try to establish a regular schedule for daily activities such as meals, bathing, and bedtime. 2. Simplify tasks. Patients with Alzheimer's disease may struggle with complex tasks, so it's important to simplify tasks and break them down into smaller steps. For example, you could provide step-by-step instructions for tasks such as dressing, brushing teeth, or preparing a snack. 3. Encourage independence. Patients with Alzheimer's disease may benefit from maintaining a sense of independence and control. Encourage patients to participate in tasks to the extent possible and provide positive reinforcement for their efforts. 4. Create a safe environment. Patients with Alzheimer's disease may be at increased risk of falls and accidents, so it's important to create a safe environment at home. This may involve removing tripping hazards, installing grab bars in the bathroom, and locking away dangerous items such as sharp objects and medications. 5. Manage behavioral symptoms. Patients with Alzheimer's disease may experience behavioral symptoms such as agitation, aggression, and wandering. It's important to develop strategies for managing these symptoms, such as redirecting patients to a different activity, providing calming activities such as listening to music, or ensuring the patient's basic needs are met. 6. Take care of yourself. Caregiving can be physically and emotionally exhausting, so it's important to take care of yourself as well. Make time for self-care activities such as exercise, hobbies, and socializing with friends and family. And consider seeking support from a support group or therapist. These are just a few tips for handling an Alzheimer patient at home. Every patient is unique, and it's important to tailor caregiving strategies to the individual patient's needs and abilities. A healthcare professional or specialist in dementia care can provide additional guidance and support for caregivers. What do Alzheimer patients forget first? Alzheimer's disease typically affects a person's memory, but the specific aspects of memory that are affected can vary from person to person. Generally, Alzheimer's patients tend to have the most difficulty with short-term memory and recent events, while a long-term memory and memories from the distant past may remain intact for longer. Here are some specific things that Alzheimer's patients may forget first. 1. Recent events. Alzheimer's patients may have difficulty remembering recent events, conversations, or interactions. This may include forgetting what they had for breakfast or what they did earlier in the day. 2. Names and faces. Alzheimer's patients may have difficulty remembering the names of people they have met recently, or even people they have known for a long time. They may also have difficulty recognizing familiar faces. 3. Words and language. Alzheimer's patients may have difficulty finding the right words to express themselves, or understanding the words that others are saying. Sequences and routines. Alzheimer's patients may have difficulty remembering the steps involved in routine tasks, such as preparing a meal or getting dressed. 4. Spatial awareness. Alzheimer's patients may have difficulty navigating familiar environments or understanding spatial relationships. It's important to note that the specific aspects of memory that are affected can vary from person to person, and that Alzheimer's disease can also affect other cognitive abilities such as problem-solving, decision-making, and judgment. Does watching TV or movies help patients with Alzheimer? Watching TV or movies may provide some benefits for patients with Alzheimer's disease, but it depends on the individual patient and their preferences. Here are some potential benefits of watching TV or movies for Alzheimer's patients. 1. Stimulation. Watching TV or movies may provide stimulation for patients with Alzheimer's disease, helping to keep their minds engaged and active. 2. Social interaction. Watching TV or movies with family or friends may provide an opportunity for social interaction, which can be beneficial for patients with Alzheimer's disease. 3. Relaxation. Watching TV or movies may provide a source of relaxation and enjoyment for patients with Alzheimer's disease, which can help to reduce stress and anxiety. 4. Memory stimulation. Watching TV or movies may provide a source of familiar or nostalgic memories for patients with Alzheimer's disease, which can help to stimulate memory recall. However, it's important to note that not all patients with Alzheimer's disease may enjoy or benefit from watching TV or movies. Some patients may become overwhelmed or confused by the sensory input, or may have difficulty following the plot or understanding the dialogue. In addition, excessive TV or movie viewing may be detrimental to cognitive and physical health. Overall, it's important to consider each patient's individual preferences and abilities when determining whether or not to include TV or movie viewing as part of their care plan. Caregivers and healthcare professionals may also consider other non-pharmacological interventions, such as music therapy or cognitive stimulation, as alternative forms of stimulation and engagement for patients with Alzheimer's disease. Hallucination. How do you handle an Alzheimer patient in agitation or hallucination? Handling an Alzheimer patient in agitation or hallucination can be challenging, but there are several strategies that can help to manage these symptoms. Here are some tips for handling an Alzheimer patient in agitation or hallucination. 1. Remain calm. It's important to remain calm and patient when handling an Alzheimer patient in agitation or hallucination. Avoid becoming agitated or confrontational, as this may escalate the situation. 2. Validate their feelings. Patients with Alzheimer's disease may become agitated or hallucinate due to fear, confusion, or frustration. It's important to validate their feelings and acknowledge their experiences, even if they don't match reality. 3. Redirect their attention. Gently redirecting the patient's attention to a different activity or topic may help to diffuse the situation. For example, you could suggest taking a walk, listening to music, or engaging in a favorite hobby. 4. Provide a safe environment. Patients with Alzheimer's disease may become agitated or hallucinate due to environmental triggers such as loud noises or bright lights. It's important to provide a calm and safe environment, free from potential triggers. 5. Ensure their basic needs are met. Patients with Alzheimer's disease may become agitated or hallucinate due to physical discomfort or unmet needs such as hunger or thirst. Ensuring that the patient's basic needs are met may help to reduce these symptoms. 6. Seek medical attention. If the patient's agitation or hallucinations are severe or persistent, it may be necessary to seek medical attention. A healthcare professional may be able to provide medication or other interventions to manage these symptoms. How do you handle an Alzheimer patient who doesn't sleep at night? Managing sleep disturbances in Alzheimer's patients can be challenging, but there are several strategies that can help to improve sleep patterns. Here are some tips for handling an Alzheimer patient who doesn't sleep at night. 1. Establish a regular sleep routine. Try to establish a regular sleep routine for the patient, with consistent bedtimes and wake-up times. This can help to regulate the body's natural sleep-wake cycle. 2. Limit daytime naps. Excessive daytime napping can disrupt nighttime sleep patterns. Encourage the patient to stay active and engaged during the day, and limit daytime naps to no more than 20 to 30 minutes. 3. Encourage physical activity. Regular exercise can help to promote better sleep. Encourage the patient to engage in physical activity during the day, such as walking, gardening, or gentle stretching. 4. Create a sleep-conducive environment. Ensure that the patient's bedroom is comfortable and conducive to sleep. This may include keeping the room quiet, cool, and dark, and minimizing distractions such as TV or electronic devices. 5. Limit caffeine and alcohol consumption. Caffeine and alcohol can disrupt sleep patterns. Encourage the patient to limit consumption of these substances, especially in the evening. 6. Consider medication. In some cases, medication may be necessary to manage sleep disturbances in Alzheimer's patients. A healthcare professional can provide guidance on the use of sleep aids and other medications. It's important to approach sleep disturbances in Alzheimer's patients with patience and empathy. Remember that the patient may be experiencing physical or emotional discomfort that is disrupting their sleep. If sleep disturbances persist despite these strategies, it may be helpful to consult with a healthcare professional or specialist in dementia care. Are there dietary recommendations for an Alzheimer patient? Yes, there are dietary recommendations for Alzheimer's patients that can help to support brain health and overall well-being. Here are some dietary recommendations for Alzheimer patients. 1. Eat a balanced diet. A balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats is important for overall health and brain function. Encourage the patient to eat a variety of nutrient-dense foods. 2. Avoid processed foods. Processed foods are often high in salt, sugar, and unhealthy fats, and may contribute to inflammation and oxidative stress in the brain. Encourage the patient to avoid or limit consumption of processed foods. 3. Stay hydrated. Dehydration can contribute to cognitive impairment and other health issues. Encourage the patient to drink plenty of water and other hydrating fluids throughout the day. 4. Consider supplements. Certain supplements, such as omega-3 fatty acids, B vitamins, and vitamin D, may help to support brain health in Alzheimer's patients. Consult with a healthcare professional before starting any new supplements. 5. Limit alcohol consumption. Excessive alcohol consumption can contribute to cognitive impairment and other health issues. Encourage the patient to limit alcohol consumption or avoid it altogether. 6. Consider dietary restrictions. In some cases, dietary restrictions may be necessary due to underlying health conditions or medications. Consult with a healthcare professional to determine if any dietary restrictions are necessary for the patient. It's important to approach dietary recommendations for Alzheimer patients with sensitivity and empathy. The patient may have difficulty with meal planning, preparation, and consumption due to cognitive or physical impairments. Caregivers may need to provide assistance with grocery shopping, meal preparation, and feeding to ensure that the patient is meeting their nutritional needs. Does frequent social get-together help patients with Alzheimer? Frequent social get-togethers can be beneficial for Alzheimer's patients in several ways. Socializing can help to reduce feelings of isolation and loneliness, improve mood, and promote a sense of connection and purpose. Here are some ways that socializing can benefit Alzheimer's patients. 1. Stimulate the brain. Engaging in social activities can help to stimulate the brain and promote cognitive function. This can help to slow the progression of Alzheimer's disease and may even help to improve cognitive function. 2. Improve mood. Socializing can help to improve mood and reduce symptoms of depression and anxiety in Alzheimer's patients. Spending time with loved ones and engaging in enjoyable activities can be especially beneficial. 3. Enhance quality of life. Socializing can help to enhance the quality of life for Alzheimer's patients by providing opportunities for meaningful connections and activities. This can help to promote a sense of purpose and fulfillment. 4. Provide support. Socializing can also provide support for both the Alzheimer's patient and their caregivers. Caregivers can benefit from connecting with other caregivers and receiving support and advice, while Alzheimer's patients can benefit from the emotional support and understanding of friends and family members. However, it's important to approach socializing with sensitivity and empathy. Alzheimer's patients may feel overwhelmed or overstimulated in large social gatherings, so it's important to choose activities and events that are appropriate for the patient's comfort level and abilities. Additionally, caregivers may need to provide assistance and support during social gatherings to ensure that the patient is comfortable and safe. How do you handle an Alzheimer patient who lives in the past and believes dead ones alive? Alzheimer's patients may experience confusion and memory loss, and may often talk about people and events from the past. This can include believing that deceased loved ones are still alive. Here are some strategies for handling an Alzheimer's patient who lives in the past and believes dead ones are alive. Validate their feelings. It's important to validate the patient's feelings and avoid correcting them or arguing with them. Trying to convince them that their memories are incorrect can lead to frustration and agitation. Redirect their attention. If the patient is becoming upset or agitated, try redirecting their attention to a different topic or activity. Engage them in an activity they enjoy or talk about a topic that is less upsetting. Use reminiscence therapy. Reminiscence therapy involves encouraging the patient to talk about their past experiences and memories. This can help to reduce feelings of anxiety and depression and promote a sense of connection and purpose. Provide reassurance. If the patient is upset or anxious, provide reassurance and comfort. Let them know that they are safe and loved, and provide physical contact such as a hug or holding their hand. Seek professional help. If the patient is experiencing severe anxiety or depression, or if their behavior is causing significant stress or harm, it may be necessary to seek professional help. A healthcare professional or mental health provider can provide guidance and support for both the patient and their caregivers. It's important to approach the patient with empathy and understanding, and to provide a safe and supportive environment that meets their needs. Caregivers may need to be patient and flexible, and to adjust their approach as needed to best support the patient's well-being. At what stage an Alzheimer patient forgets family members and how do you handle them? Alzheimer's disease is a progressive condition that affects each person differently, so the point at which a patient forgets family members can vary. Some patients may begin to have difficulty recognizing family members or close friends in the earlier stages of the disease, while others may not experience this until later stages. Handling an Alzheimer's patient who forgets family members can be challenging, but here are some strategies that may help. Be patient and understanding. It's important to approach the patient with empathy and understanding, even if they don't recognize you or other family members. Remember that this is a symptom of the disease, and not a reflection of the patient's feelings towards you. Use visual cues. Using visual cues can be helpful in assisting the patient in recognizing family members. Show them photos of family members or point out familiar objects in the room. Introduce yourself. If the patient doesn't recognize you, introduce yourself with your name and your relationship to them. This can help to provide context and reduce confusion. Engage in activities together. Engaging in activities together can help to create a sense of connection and promote positive interactions. Choose activities that the patient enjoys or that have positive memories associated with them. Seek support. Caring for an Alzheimer's patient who forgets family members can be emotionally challenging. So it's important to seek support from family members, friends, or healthcare professionals. Support groups can also be helpful for connecting with others who are going through similar experiences. It's important to remember that Alzheimer's disease can be unpredictable, and that the patient's memory and behavior may change over time. Caregivers may need to be flexible and adapt their approach as needed to best support the patient's well-being. Why do Alzheimer patients not smile? Alzheimer's disease can affect a person's ability to express emotions, including smiling. There are several reasons why Alzheimer's patients may not smile, including 1. Loss of facial muscle control. Alzheimer's disease can affect the muscles in the face, which can make it difficult for patients to smile or show other facial expressions. 2. Difficulty with emotional processing. Alzheimer's disease can affect a person's ability to process emotions, which can make it difficult for them to feel happy or express positive emotions through smiling. 3. Communication difficulties. Alzheimer's disease can also affect a person's ability to communicate effectively, which can make it difficult for them to express emotions through words or nonverbal cues like smiling. 4. Depression or anxiety. Alzheimer's patients may also experience depression or anxiety, which can make it difficult for them to feel happy or express positive emotions. It's important to note that not all Alzheimer's patients experience a loss of the ability to smile. Some patients may still be able to smile and express positive emotions, while others may have difficulty with this. Caregivers can support Alzheimer's patients by providing a safe and supportive environment, and engaging in activities that promote positive emotions and socialization. Why do Alzheimer patients walk so much? Alzheimer's disease can cause changes in behavior and mobility, and some patients may walk or wander more frequently than others. Here are some possible reasons why Alzheimer's patients may walk more. 1. Restlessness and agitation. Alzheimer's disease can cause restlessness and agitation, which can lead to pacing or walking as a way to alleviate these feelings. 2. Disorientation. Alzheimer's patients may become disoriented and confused, which can lead to wandering or pacing as a way to find their bearings. 3. Searching for something. Alzheimer's patients may also walk or wander if they are searching for something, such as a familiar object or person. Physical discomfort. Some Alzheimer's patients may experience physical discomfort or pain, which can make it difficult for them to sit or lie down for extended periods of time. 4. Boredom or lack of stimulation. Alzheimer's patients may walk or wander as a way to alleviate boredom or lack of stimulation. 6. Sleep disturbances. Alzheimer's patients may also have difficulty sleeping at night, which can cause them to be more active during the day. It's important for caregivers to ensure that Alzheimer's patients are safe while walking or wandering, and to provide a supportive and stimulating environment to promote engagement and reduce restlessness. This may include taking walks with the patient, providing engaging activities, and ensuring that the patient is getting enough physical activity during the day. Additionally, caregivers may need to implement safety measures such as locks on doors or alarms to prevent the patient from wandering outside or getting lost. How do you handle bathing for an Alzheimer patient? Bathing can be a challenging activity for Alzheimer's patients, as they may have difficulty understanding the process or may feel uncomfortable with the sensations of water or soap. Here are some tips for handling bathing for an Alzheimer's patient. 1. Establish a routine. Try to establish a regular bathing routine so that the patient knows what to expect. This can help reduce anxiety and increase familiarity with the process. 2. Respect the patient's dignity. Allow the patient to maintain as much privacy and control as possible during the bathing process. Use a shower curtain or privacy screen if necessary. 3. Make the environment comfortable. Make sure the bathroom is warm and well lit, and consider using non-slip mats or handrails to increase safety. 4. Use simple, clear instructions. Give simple, clear instructions and allow plenty of time for the patient to process and respond. Use visual cues such as pointing to indicate which body part to wash. 5. Use gentle, soothing techniques. Use gentle, soothing techniques such as soft sponges or washcloths and warm water. Avoid using harsh soaps or scrubbing too hard. 6. Be patient and understanding. Bathing can be a difficult and uncomfortable process for Alzheimer's patients, so it's important to be patient and understanding. Be prepared to adjust the bathing routine as necessary to accommodate the patient's needs and preferences. 7. Provide comfort and reassurance. Offer comfort and reassurance throughout the process, and provide positive feedback and encouragement when the patient completes each step. By following these tips, caregivers can help make the bathing process as comfortable and safe as possible for Alzheimer's patients. How do you handle an Alzheimer patient who had lost toilet habits? Loss of toilet habits is a common problem among Alzheimer's patients, as they may have difficulty recognizing when they need to use the bathroom or finding their way to the toilet. Here are some tips for handling this situation. 1. Provide regular meals. Establish a regular meal schedule and provide meals at the same time each day. This can help the patient become familiar with the routine and maintain a consistent eating schedule. 2. Serve easy-to-eat foods. Serve foods that are easy to eat and digest, such as soft foods, chopped or pureed fruits and vegetables, and finger foods. 3. Provide visual cues. Use visual cues such as pictures or drawings to help the patient understand what foods are being served and how to eat them. 4. Monitor hydration. Monitor the patient's fluid intake and provide plenty of water and other hydrating fluids throughout the day. 5. Offer assistance. Offer assistance with eating and drinking as needed, and provide positive feedback and encouragement when the patient successfully eats or drinks. 6. Consult a healthcare provider. If the patient is experiencing significant changes in eating habits or is at risk for malnutrition or dehydration, consult a healthcare provider for further evaluation and treatment. Do they forget how to swallow food? In some cases, Alzheimer's patients may forget how to swallow food, a condition known as dysphagia. This can be caused by changes in the brain that affect the coordination of the muscles involved in swallowing, as well as by other factors such as poor oral health, dehydration, or medication side effects. If an Alzheimer's patient is experiencing difficulty swallowing, it is important to seek medical attention promptly. A healthcare provider can assess the patient's condition and determine the underlying cause of the problem. They may also recommend strategies to help manage dysphagia, such as 1. Adjusting food consistency. Soft foods, pureed foods, and thickened liquids may be easier to swallow for patients with dysphagia. 2. Modifying eating and drinking habits. Eating slowly, sitting upright, and taking small bites or sips can help patients with dysphagia swallow more easily. 3. Providing assistance. A caregiver or healthcare provider may need to provide physical assistance with eating and drinking, such as feeding the patient or using specialized feeding tubes or devices. 4. Referring to a specialist, a speech-language pathologist or other swallowing specialist, can help assess the patient's swallowing function and provide tailored treatment and management strategies. Do Alzheimer patients become violent? Some Alzheimer's patients may experience behavioral and psychological symptoms, including agitation, aggression, and even violence. These symptoms may be triggered by a variety of factors, such as changes in the environment, difficulty communicating, or frustration with daily activities. It is important for caregivers and healthcare providers to be aware of these symptoms and to work together to manage them in a safe and effective way. Here are some strategies that may be helpful in managing aggression and violence in Alzheimer's patients. Identify triggers. Identify the situations or factors that tend to trigger aggression or violence in the patient, and try to avoid or minimize these triggers as much as possible. Provide a calm and supportive environment. Create a calm, quiet environment for the patient, with minimal distractions and disruptions. Provide reassurance and support as needed. Communicate effectively. Use clear, simple language and nonverbal cues to communicate with the patient. Avoid arguing or confronting the patient, as this may escalate the situation. Offer diversional activities. Provide activities that the patient enjoys and finds engaging, such as listening to music, doing puzzles, or going for walks. Consult a healthcare provider, if the patient's aggression or violence is severe or persistent. Consult a healthcare provider for further evaluation and treatment. Medications or behavioral therapies may be helpful in some cases. By taking a proactive approach to managing behavioral and psychological symptoms in Alzheimer's patients, caregivers and healthcare providers can help promote safety and improve quality of life for both the patient and the caregiver. Do Alzheimer patients get affected by other psychiatric problems like depression or bipolar disorder, etc.? Yes, Alzheimer's patients can be affected by other psychiatric problems, including depression, anxiety, and bipolar disorder. These conditions can be challenging to diagnose in Alzheimer's patients, as their symptoms may be similar to those of dementia or may be difficult to distinguish from the effects of aging. Depression is a common psychiatric problem in Alzheimer's patients, and may be caused by a variety of factors. such as changes in brain chemistry, chronic pain or illness, or social isolation. Symptoms of depression in Alzheimer's patients may include changes in mood or behavior, loss of interest in activities, feelings of worthlessness or hopelessness, and changes in appetite or sleep. Bipolar disorder, which is characterized by cycles of depression and mania, may also occur in Alzheimer's patients. Symptoms of bipolar disorder in Alzheimer's patients may include mood swings, high levels of energy or agitation, and impulsive behavior. Anxiety is another common psychiatric problem in Alzheimer's patients, and may be caused by changes in the brain or by environmental factors such as stress or social isolation. Symptoms of anxiety in Alzheimer's patients may include feelings of restlessness or unease, excessive worrying or fear, and physical symptoms such as sweating or palpitations. Schizophrenia is a less common psychiatric disorder in Alzheimer's patients, but it can occur in some cases. Schizophrenia is a chronic and severe mental illness that affects how a person thinks, feels, and behaves. It is characterized by symptoms such as delusions, hallucinations, disordered thinking and speech, and impaired social functioning. Symptoms. The symptoms of schizophrenia can be difficult to distinguish from the symptoms of dementia, especially in older adults. However, some studies have suggested that there may be an increased risk of schizophrenia in people with Alzheimer's disease, and that these conditions may share some underlying genetic or environmental risk factors. If an Alzheimer's patient is experiencing symptoms that suggest schizophrenia, such as delusions or hallucinations, it is important to seek the advice of a healthcare professional. A thorough evaluation can help determine the underlying cause of the patient's symptoms and identify appropriate treatment options. Treatment for schizophrenia typically involves a combination of medications and psychosocial therapies, and may be tailored to the individual needs and preferences of the patient. It is important for caregivers and healthcare providers to be aware of the potential for psychiatric problems in Alzheimer's patients, and to work together to diagnose and manage these conditions effectively. Treatment may include medications, behavioral therapies, or other interventions to address the underlying causes of the patient's symptoms and improve their overall quality of life. How long a patient live with Alzheimer? The progression and duration of Alzheimer's disease can vary greatly from person to person. The disease is progressive, meaning that symptoms tend to worsen over time, but the rate of progression can be highly variable. On average, a person with Alzheimer's disease may live for 8 to 10 years after their initial diagnosis, but some individuals may live for as long as 20 years or more. Factors that can affect the progression of Alzheimer's disease include the age and overall health of the patient, the severity of the initial symptoms, and the presence of other medical conditions. Treatment can also have an impact on the progression of the disease, as some medications and interventions may help slow the decline of cognitive and functional abilities in some patients. It is important to note that Alzheimer's disease is a terminal illness, and that patients may require increasing levels of care and support as the disease progresses. Caregivers and healthcare providers can work together to develop a comprehensive care plan that addresses the patient's physical, emotional, and social needs throughout the course of the disease. What is the end stage of Alzheimer? The end stage of Alzheimer's disease, also known as late stage or severe Alzheimer's, is characterized by a significant decline in cognitive and physical abilities. At this stage, the disease has progressed to the point where the person is no longer able to carry out daily activities without assistance and may require round-the-clock care. Some common symptoms of the end stage of Alzheimer's disease include 1. Severe memory loss, including difficulty recognizing familiar people and places. 2. Difficulty communicating, including difficulty speaking or understanding language. 3. Loss of mobility, including difficulty walking or sitting upright. 4. Incontinence, or loss of control over bowel and bladder function. 5. Significant weight loss or malnutrition. 6. Increased susceptibility to infections, such as pneumonia or urinary tract infections. Hospice care may be appropriate for some patients, as it provides specialized medical and support services to individuals with terminal illnesses.